Hi everybody, how you doing? My name is Scott, for those who don't know me, and I'm just going to take a little bit of your time today to talk to you a little bit around psychedelic therapies, more particularly around psychedelic integration. So look, psychedelic integration is something that I really believe wholeheartedly in. I think there has been quite a big uptake in the conversation around psychedelics, particularly around mental health and mental health support in society today. And look, it is something I offer through my practice, the integration, not the therapies. I want to be very clear around that. I do not offer psychedelic therapies for clients, but rather the integration. So look, I want to start this off simply by saying that I do not believe that psychedelic therapy or psychedelics are suited for everyone, nor are these magical panacea for mental health issues. I believe that these medicines hold a certain value in their application when they're coupled with the appropriate levels of support and safety to assist the individual in their therapeutic journey. I'm in no way endorsing individuals to engage in the use of psychedelics outside of clinical use. So I want to be very clear on that. I am also, however, aware that people are going to make their own choices when it comes to these matters, which is why I kind of feel it's important to educate and support them in order to integrate and cope with their wide range of experiences that may come from using any of these sorts of substances available. So maybe we begin this chat today really by talking about the reasons why there has been resurgence in psychedelics, particularly in the mental health landscape. So if we start, probably best to look at what was going on in US in the mid 90s, because around that time, the FDA winds up approving phase one trials for DMT, psilocybin, and MDMA. So these trials begin, and right around the early 2000s, you have a big institution like John Hopkins, which uptakes, particularly around the use and study of psilocybin in therapy for treatment-resistant depression. So they start in 2000, and around 2006 they start to release their first findings, which show some really promising results in those beginning trials. Then you also have other institutes like MAPS, which is the Multidisciplinary Association for Psychedelic Studies. They move into phase two trials for MDMA assisted therapies, particularly around PTSD. So you kind of have about a 20-year period there where multiple institutions are leading studies, doing a lot of clinical research and trials, and releasing a lot of promising results, which are being published in a multitude of medical journals and being vetted by all the appropriate people. Look, once you move to around 2019, the FDA actually winds up granting what they call breakthrough therapy designation to both MDMA and psilocybin for their treatment of depression as well as PTSD. So that's a big moment in sort of the landscape of psychedelics in the therapeutic setting there. And in 2021, you actually see the phase three trials of MDMA therapy where they released findings to show that just over 67% of the participants in these trials were no longer meeting the criteria necessary for a PTSD diagnosis. So really big things happening in there. Look, I think this all kind of winds up culminating ultimately in 2023, where July that year, the TGA in Australia actually winds up approving the prescription of MDMA and psilocybin for the treatment of resistant depression and PTSD. And this actually makes Australia the very first country in the world to legalize the prescription of psychedelic drugs in the therapeutic setting. Now, look, that being said, they legalize the prescription of it. The way that it is administered is very closely, tightly regulated, which we'll go into a little bit later on. So, look, maybe let's talk, I guess, at this point around why people actually are seeking out these therapies now more than ever. So, I think one of the big things that I notice personally in my practice and what I hear from a lot of people is that there is actually just a real deep level of frustration as well as desperation that a lot of people are feeling when it comes to the current medical system, as well as the options available to them. Now, I don't necessarily believe that the resurgence of psychedelics is wholly indicative of people's feelings on the state of the system, if you will. But I also am aware that there is probably a good portion of people that are hearing all these positive stories coming out, and they're seeing these substances and these medicines as being, if anything, maybe a bit of an easier or quicker alternative to prolonged therapy, or going through that sort of like trial and error phase that can often happen when it comes to pharmaceutical drug options. So while it has been shown, I guess, that psychedelic assisted therapy has, in some cases, accelerated the therapeutic process for certain individuals, there is still actually a hell of a lot of work that is required to be done for these people when they are participating in these alternative therapies. And part of that work is working with the correct people in order to foster safety as well as sustainable development of their mental health. So another reason that people are seeking this out is there has been just a wealth of positive media portrayal. So over the last decade in particular, honestly, I think there has been no shortage of positive media that you can find that the role of psychedelics and psychedelic assisted therapy have been playing in the field of mental health and wellness. So that ranges obviously from like news stories to medical journals, internet articles, documentaries, books galore. You know, if you just kind of take that all at face value, seemingly psychedelics are kind of revamping the landscape of mental health support and wellness globally. But what a lot of people don't understand, because unfortunately, I guess we live in a society of what I call headline scholars. A lot of people just read the headline of an article or a piece, and they believe they get all the information they need from that. So a lot of people aren't actually aware that these positive results that are coming out of these medicines and out of these therapies, well, they're being yielded from very closely controlled clinical settings where not only the substances but the dosages are being expertly controlled and monitored. So the people in these clinical studies were also being incredibly well supported and expertly supported in the preparation phase, in the dosing phase, and really importantly in the integration phase post dosing, which is creating this entire ecosystem really conducive towards positive growth and healing through these alternative therapies. And I think it's really also important to note that even within these like incredibly carefully curated environments, you're actually still seeing participants that wind up having negative experiences with these substances, and they require further support to be able to cope with the outcomes that are coming out of this. So I think one of the other things that I've noticed as well, driving this sort of public interest and push towards these psychedelics is realistically, look, there are very few clinics. If we just want to talk about Perth, Australia, there's very few clinics here that are offering these therapies, right? So the access to either clinical administration or clinical trials, as well as the prohibitive cost of these treatments overall, is actually driving a real big underground movement. So realistically, in Australia, if you want to get into a trial, it's very difficult. But if you want to get into a clinic, your out-of-pocket cost can be anywhere between $25,000 to $50,000. Now that cost covers working with a psychiatrist prior to getting a diagnosis, which allows you to access the treatment, getting you the prescription for the medicines, which are then administered by the clinic. So the client never actually gets to get a hold of the substance themselves. It has to be filled and administered by the clinic. And then during that time, they're being supported through three 90-minute integration, 90-minute preparation sessions, an 8-hour dosing session, as well as three 90-minute integration sessions. Now, all those are being done in a dyad, so two clinicians working with the client the entire time. Um, Obviously, look, that's a lot of manpower. Oh, I think it's important also to note, like one of those clinicians through that whole thing either has to be a registered clin psych or psychiatrist, right? So you're looking at a lot of manpower, you're looking at a lot of time and a lot of experience being put into a single client. So that 25K cost, realistically, when you look at all the time and all the work that goes into it, is not really that out of whack with what they're receiving. That being said, that is a price tag that most people cannot afford on their own, nor is a price tag that many healthcare funds are even willing to consider helping to cover. I know there are a couple of healthcare funds at the moment, and also the Veterans Association is looking to try and help supplement the cost of MDMA therapy for veterans who are experiencing PTSD. But at the moment, any extra support outside of your own personal bank account is not really available to many people. So this is actually driving many individuals in the public sector to try and seek out either underground practitioners who are offering these therapies or just procuring the substances themselves and trying to have some transformative and profound experiences on their own. And unfortunately, many of the practitioners who are offering these therapies outside of the legal and clinical realms, they are ill equipped to be able to do so. They might not have any sort of therapy training whatsoever. They might be some, sort of self-prescribed urban shamans. And when individuals are doing it on their own, they're not necessarily being supported to be able to deal with any sort of negative consequences or even deal with the positive consequences that come from these substances, right? So that is why, again, I think the sort of education, the training and support is really critically important to be able to work with individuals who are seeking these methods out outside of these other realms, because we're all adults and people will do what they want. So having that appropriate level of understanding and training to help them make some sense and find some meaning out of what they experience, I think is really important, especially if they've had those negative experiences and they become what we refer to as psychedelic casualties. And there's a lot more that I'm seeing in my own practice, which is one of the things that drove me to go out and actually do the training. So, look, last thing I want to touch on here is just basically let's just talk about like what is psychedelic integration. So when people are going and having these experiences either in clinics or in intentional settings for trying to find some sense of healing and growth within themselves, um, they are open to some pretty profound experiences that might come up for them, right? So when we're looking at psychedelic integration, I think the key components of it are trying to bring the client back to themselves while identifying any sort of key insights and experiences they may have had, and also identifying those obstacles that they may have encountered during their dosing session. So working with a client in a safe, understanding, and grounding way can lead them to be able to incorporate and embed any of these potential lessons and insights into their everyday lives, carrying it forward with them to create, lasting and helpful change in what they are currently dealing with. So it's an interesting thing because when you are working with clients who've had these experiences, sometimes you do have to understand that not all of these experiences will be able to you'll be able to make sense of it, right? Whether in the session or the dosing experience for the client. So it's not always about trying to make meaning with the client or help them find some meaning, but sometimes it's actually more about just trying to lead them to some sense of acceptance that there are things that may actually remain out of their grasp or might wind up still be discomforting and unresolved, right? Because even when there are insights being gained from these experiences, they should also still be left open rather to alternative interpretations in the future, because this actually allows the client to continue to find meaning out of these experiences as they grow in their own understanding of self. So, look, I hope you guys found this useful and a little bit insightful as to what this sort of landscape is currently looking like here in Australia and globally. And if you want any more information around this, please feel free to reach out. Or if you are a person who has undergone some experience with psychedelics and is struggling to make meaning out of it, or wants just that ability to sort of unpack it with someone who is experienced in these therapies, please feel free to reach out. Thank you very much.